Pain is a universal experience, but how we manage it can take very different forms. In this video, we'll explore the two main medical strategies for pain relief: analgesics and anesthetics. Whether you're dealing with a headache or preparing for surgery, understanding these options can empower you to make informed decisions about your care. We'll break down how each approach works when they're used and what makes them unique. By the end, you'll have a clear grasp of how modern medicine tackles pain from two fundamentally different angles. Both analgesics and anesthetics aim to relieve pain, but they do so in fundamentally different ways. Analgesics are the go-to for managing ongoing pain without affecting consciousness, making them ideal for daily discomforts. Anesthetics, on the other hand, are designed to prevent pain entirely, often by numbing a specific area or inducing unconsciousness for medical procedures. Understanding the distinction between these two approaches is crucial for choosing the right treatment for your need. Analgesics are medications that relieve pain without causing a loss of consciousness. They are often the first line of defense for managing everything from mild headaches to severe post-surgical pain. Their core function is to ease discomfort while allowing you to continue your daily activities. Analgesics work after pain has already started, making them essential for ongoing pain management in a variety of situations. Anesthetics are medications used to induce anesthesia, which can range from numbing a small area to causing a temporary state of unconsciousness. Their primary role is to enable medical procedures by preventing pain before it starts. Anesthetics are essential for surgeries and invasive treatments, allowing patients to undergo procedures that would otherwise be unbearable. Pain control isn't one size fits all. Both analgesics and anesthetics come in different types, each tailored to specific situations. In the next few scenes, we'll take a closer look at the main families of pain control medications, starting with the three primary types of analgesics and then exploring the three scales of anesthesia. Non-opioid analgesics are the everyday pain relievers most people are familiar with. They're used for mild to moderate pain, such as headaches, sprains, or minor injuries. Common examples include acetaminophen, ibuprofen, and aspirin. These medications are widely available over the counter and are often the first choice for common aches and pains. Opioid analgesics are reserved for more severe pain, such as after surgery or following a significant injury. These medications, including morphine, codeine, and oxycodone, are powerful and effective but come with a higher risk of side effects and dependence. They are typically prescribed when other pain relief options are insufficient. Topical analgesics are applied directly to the skin to target localized pain, such as arthritis or muscle soreness. These come in the form of creams or patches, often containing ingredients like lidocaine or capsaicin. They provide relief right where it's needed, minimizing systemic side effects. Anesthesia isn't just about putting someone to sleep. There are three main types, each suited to different procedures. Local anesthetics numb a small area, regional anesthetics block sensation in a larger region, and general anesthetics induce a deep, unconscious state for major surgeries. Let's explore each type in more detail. Local anesthetics are used to numb a small, specific area of the body. They're commonly used for minor procedures like dental fillings or stitches. The patient remains awake and alert but feels no pain in the targeted area. This approach is precise and minimizes the impact on the rest of the body. Regional anesthetics are used to numb a larger section of the body, such as an entire limb or the lower half. A common example is the epidural, often used during childbirth. This method allows patients to remain conscious while blocking pain in a specific region, making it ideal for certain surgeries and procedures. General anesthetics are used for major surgeries that require the patient to be completely unconscious. This type of anesthesia affects the entire body and ensures that the patient has no memory of the procedure. It's a complex process that requires careful monitoring by medical professionals to ensure safety throughout the operation. Analgesics work by interrupting the pain signal in different ways. Non-opioid analgesics like NSAIDs target the source of pain and inflammation by blocking the COX enzyme, which prevents the production of prostaglandins, chemicals responsible for pain and swelling. This approach is effective for many types of mild to moderate pain. Non-opioid analgesics primarily work at the site of pain. By blocking the cyclooxygenase COX enzyme, they stop the production of prostaglandins, which are chemicals that cause pain and inflammation. This mechanism makes them effective for treating headaches, muscle aches, and other inflammatory conditions. Opioid analgesics work centrally in the brain and spinal cord. They bind to opioid receptors, reducing the brain's perception of pain and triggering the release of dopamine. This not only lessens pain but can also create feelings of pleasure and relaxation. However, this powerful effect comes with a higher risk of dependence and side effects. Anesthetics work by blocking sensation entirely, either in a specific area or throughout the whole body. Local anesthetics stop nerves from sending pain signals to the brain by temporarily blocking electrical impulses along nerve fibers. This targeted approach is highly effective for minor procedures. Regional anesthesia involves injecting anesthetic near a cluster of nerves, effectively blocking sensation in an entire region of the body. This technique is commonly used for surgeries on the limbs or lower body, allowing patients to stay awake while remaining pain-free in the targeted area. General anesthesia is a multi-stage process that modifies the central nervous system, inducing a deep, reversible state of unconsciousness. The process includes induction and maintenance stages with vital signs closely monitored throughout. This ensures patient safety and comfort during major surgeries. The effects of anesthesia are carefully controlled and monitored. Before anesthesia, patients are awake and aware. After induction, they enter a state of deep unconsciousness with no memory of the procedure. Recovery is closely supervised to ensure a safe return to normal consciousness. Selecting between analgesics and anesthetics depends on the situation. Analgesics are ideal for everyday pain and discomfort such as headaches, toothaches, and muscle soreness. Anesthetics are essential for medical and surgical procedures where pain prevention is critical. Analgesics are used for a wide variety of common aches including headaches, toothaches, and muscle soreness. They're a staple in most households and provide reliable relief for many types of discomfort, allowing people to maintain their daily routines. Pain management with analgesics covers a broad spectrum from minor aches to more persistent discomforts. These medications are often the first step in addressing pain, providing quick and effective relief for most people. Anesthetics are indispensable for surgeries. General anesthesia is used for major operations like heart or brain surgery, regional anesthesia for limb procedures, and local anesthesia for minor excisions. Each type is chosen based on the procedure and patient needs. Some analgesics also help reduce fever by acting on the brain's temperature control center. This dual action makes them valuable for treating both pain and fever, especially during illnesses like the flu or common cold. Local anesthesia is standard for dental procedures such as fillings, extractions, and root canals. Sometimes, nitrous oxide is used to reduce anxiety, making dental visits more comfortable and pain-free. Analgesics, especially NSAIDs, are effective at reducing inflammation. They help control swelling, redness, and warmth associated with injuries, sprains, and chronic conditions like arthritis, improving comfort and mobility. Regional anesthesia, such as an epidural, is widely used during childbirth. It allows mothers to remain conscious and participate in the birth experience while effectively managing labor pain. While non-opioid analgesics are generally safe, they can cause side effects. Common issues include digestive problems like heartburn and nausea, as well as potential kidney and liver concerns with long-term use. Aspirin can increase bleeding risk, and allergic reactions are possible in some individuals. Opioid analgesics carry a higher risk of side effects, including drowsiness, constipation, and the potential for dependence and addiction. Respiratory problems can occur at high doses, making careful monitoring essential when these medications are prescribed. General anesthetics can cause mild side effects like grogginess, confusion, nausea, vomiting, sore throat, and shivering after surgery. Rarely, allergic reactions may occur, which is why continuous monitoring by an anesthesiologist is so important during and after the procedure. Local and regional anesthetics are generally safe, but they can cause temporary numbness or tingling after the procedure. Bruising or soreness at the injection site is common, and in rare cases nerve damage may occur, usually resolving over time. Maria, a working mother with severe back pain, found that over-the-counter analgesics allowed her to resume her daily routine. However, she also learned the importance of combining medication with physical therapy and mindfulness for long-term relief. Her story highlights the value of a balanced approach to pain management. Jim, a dedicated runner with chronic knee pain, relied on prescription analgesics to continue his passion. However, he had to carefully balance the benefits of pain relief against side effects like nausea. Jim's experience underscores the need for personalized care and ongoing communication with healthcare providers. Eric was anxious about an upcoming surgery. The anesthesiologist took time to explain the process, which provided immense comfort. After the procedure, Eric woke up groggy but grateful to have no memory of the surgery, highlighting the effectiveness and reassurance that anesthetics can provide. Samantha underwent dental surgery with a local anesthetic. She recalled a fascinating tingling sensation but no pain during the procedure, underlining the remarkable precision and effectiveness of local numbing techniques in modern dentistry. Safe use of analgesics starts with patient responsibility. Always read the instructions and stick to the recommended dose. Check for potential interactions with other medications, be aware of any personal allergies, and consult a healthcare professional if pain persists. These steps help ensure effective and safe pain management. Anesthetics are administered under strict professional protocols. A detailed patient history is taken to assess risks and allergies. Vital signs are continuously monitored, and the type of anesthetic is carefully chosen based on the procedure and patient health. Post-procedure observation is crucial for a safe recovery. Future of pain management is becoming more personalized and precise. Emerging trends include tailoring treatments to an individual's genetics and lifestyle, using digital health tools like wearable devices to track pain levels, and integrating holistic approaches such as physical therapy and meditation alongside medication. Digital health tools are transforming pain management. Wearable devices can now track pain levels and provide real-time feedback to both patients and doctors. This technology enables more responsive and personalized care, helping to optimize treatment plans and improve outcomes. Holistic approaches are gaining traction in pain management. Non-pharmacological treatments like physical therapy, meditation, and mindfulness are being used alongside medications to provide comprehensive care. This integrative strategy addresses both the physical and emotional aspects of pain. Gene therapy is an exciting area of research, aiming to target pain at its genetic source for long-lasting solutions. By addressing the underlying causes of pain at the molecular level, gene therapy holds the promise of more effective and durable relief in the future. Regenerative medicine uses stem cells to repair damaged tissue and reverse the causes of pain. This innovative approach could revolutionize pain management by addressing the root causes rather than just the symptoms, offering hope for those with chronic pain conditions. Virtual reality (VR) is being explored as a tool for pain relief. By immersing patients in calming environments, VR can help reduce the perception of pain and anxiety during medical procedures or chronic pain episodes. This non-invasive approach is showing promising results in clinical studies. If you're interested in learning more about pain management, there are many resources available. Books, journals, online courses, and visual explainers can provide deeper insights. Whether you're a student, healthcare professional, or simply curious, structured learning can help you stay informed about the latest advances in the field. Summary: both analgesics and anesthetics play vital roles in pain management. Analgesics help us manage everyday discomforts and ongoing pain, while anesthetics make surgeries and invasive procedures possible. As medicine advances, treatments are becoming more personalized, precise, and holistic. Understanding your options is the first step toward effective pain relief and better health.